The first permanent molar has had the front part of the tooth removed and the bone and the gum tissue that would be covering it removed. In addition, all of the bone covering the roots of all of the teeth have been removed to expose the pathway for the blood vessels and the nerves. They travel in a little canal at the bottom of the jawbone and give off branches and supply each of the teeth. Teeth consist of a crown, which is the part of the tooth that you see above the gum line, and a root, which is the part that's embedded in the tooth. Here's a permanent tooth root. Here's the root of one developing, and in the incisors, the roots. The neck of a tooth is a little constriction between the crown and the root. So the three parts are the crown, the neck, which is transitional, and then the root of the tooth. And take this tooth out. In the root of the tooth, there's a little opening called the apical foramen. And it's through that opening that the blood vessels and nerves pass into the interior of the root. That's why this one is cut away so we can see what's happening. So the white's meant to represent nerve and the red is meant to represent blood vessels. And these are entering in through the roots. This particular tooth happens to have two roots, and the nerves and blood vessels are continuing up deep into the interior of the crown, where there's a hollow space called the pulp chamber. And the blood vessels and the nerves that are in the pulp chamber are known as the pulp of the tooth. This is what gives life to the interior of the tooth. The exterior of the tooth is covered in enamel, which is the hardest substance in the body, and a little bit below that, a layer of dentin, which is also hard, but not as hard as the enamel. Both the enamel and dentin are non-living. The pulp, however, because they're blood vessels and nerves, is alive. The nerves give feeling to the tooth.